The sun rises over Kifa. It is 7 a.m. in this city in southern Mauritania, located 600 kilometers from the capital Nouakchott. The city awakes and the hustle and bustle will resume in this town where Kumba and her 6 children live. This morning we have an appointment with Kumba, who has agreed to speak with us, face uncovered, in spite of the hardship she has been through and the resulting isolation. She was a victim of a fistula, the shameful disease as she calls it. It was in 2011, following an extended labor during her 3rd childbirth. She was afflicted by the disease for 5 years. 5 years spent searching for solutions, punctuated by moments of seclusion. Kumba is now cured, but she still bears the bitter memory of that period of her life. It is with a heavy heart that she tells us what she went through. It's a difficult illness. I was often isolated. I had to change sanitary pads very often. But my illness kept on afflicting me, so I started to pray again. I always had water with me to wash. I couldn't do any other activity. I didn't know that this illness could be cured. Otherwise, I wouldn't have stayed such a long time with it. It's thanks to Sedi Camara that I got to know that the illness could be cured. I immediately got in touch with Sedi Camara when I found out. I was able to heal, thanks to her, so to speak. Furthermore, her association helped me get a revenue-generating activity, and I was able to do a training to get to carry out such an activity. For me, it's my duty today to talk about fistulas in order to help other women who are suffering in silence. Later in Nouakchott, we will meet Sedi Camara, the lady who helped Kumba. But before that, we follow Kumba, who, after the interview, gets ready to go to work. Yes, she works now and provides for her needs and those of her family, unlike the period when she endured the diktat of the disease. Since being cured, Kumba's occupation is fabric preparation and dyeing, thanks to financing from the NGO, the Association of Voluntary Women for Development. This activity has changed her life. Many things have changed for me. Today I can buy clothes for my children, and provide for our needs. So this activity is very important for us. I was able to earn a lot and buy livestock. So now I do livestock breeding thanks to the income that I got here. And I'm also able to save money. The dye costs a lot, so if I was able to access the products at a lower cost, I would be able to develop further my dyeing activity and to better equip our workshop. Kia and her husband manage a family cooperative in Kifa. El Jazeera is the name of the cooperative created in 2003, which operates mainly in the field of agriculture. The cooperative is made up of 18 people from 3 families. This morning, as per usual, Mohammed, Kia's husband, and other members of the cooperative are working in their agricultural space, which they started exploiting in 1996. Here, several cultures grow in bulk.
Now we have 1 hectare of land. At first we planted palm trees, we planted henna, and then we moved on to vegetable farming, and it's with vegetable farming that we really started making a profit. We cultivate tomatoes, carrots, onions, potatoes and okra, especially okra. There is a period if you have 2 okra plants, then you will earn each day 500 or 600 ouguiyas because the okra can be sold at 10 ouguiya, sometimes 5 ouguiya or sometimes 20.
5 ouguiya, parfois 20 ouguiya.
In view of modernizing the agricultural activities, the cooperative took part in March 2019 in a contest organized by the SWED, the Sahel Women Empowerment and Demographic Dividend Project. This contest, called the Female Entrepreneurship Marathon, aimed at supporting the development of projects led by women. In September 2019, Al Jazeera was one of the 20 cooperatives who won a prize. They won a check of a little more than 50,000 ouguiya, approximately 1 million francs CFA. It's a support that is great for us. We are very happy with this support. We are very proud of this support. We haven't received the support yet, but when we do receive it, we will sit down together and decide together what we will do. We will establish our priorities and the priorities of the cooperative. I think that one of our priorities is fencing and fencing angles. And we have another priority, which is the motor pump. Because the women can't always go to the well, and the men are very few, and here there are only children or elderly, as you can see.
Things will certainly improve here. Why? Because before we used to have nothing and we would still run our activity. Now, if we get some help, some funding, a credit, it will help us move forward. We will definitely move back. So certainly there are a lot of things that are missing, because here we have only the labor of our hands and our muscles to work.
Aminatou is also head of a cooperative of 10 women and 2 men who benefited from the support of the Suède project. She intends to invest the 150,000 ouguiya, approximately 2,500,000 francs CFA, which she received to rebuild her guest house. Here is the land dedicated to this project of the Angar cooperative. Aminatou intends to rebuild her new guest house on the ruins of the old one, which only recently welcomed travelers passing through Kifa. While waiting for the Suède financing, the cooperative has already begun the implementation of the project on their own means. So we have already started to renovate the rooms that are here, but also the warehouse and the fencing. When we receive the funding, the face of the guest house will completely change, and we will be able to welcome travelers who are passing through Kifa. We focus on passengers coming from Nouakchott, but also on those coming from Mali and Burkina Faso. They will be able to find here a place to stay, and then we will be able to have a revenue in order to provide for the needs of our families. We, the members of this cooperative, expect a lot from this project. It represents one of the main sources of revenue. The member of this cooperative who work here will be able to have wages and monthly salaries, which will enable them to improve their living conditions. So we hope that the project will be completed soon. In Kifa, 5 cooperatives and 29 girls have benefited from income-generating activities within the framework of the Female Entrepreneurship Marathon of the Suède project.
The funding will bring about a lot of changes for the families. If we look at the cooperative, we have 5 cooperatives who have benefited from funding to improve their activity. So in those cases, the members of the cooperative will benefit from the advantages during the project. So in each cooperative, all the families of the cooperative will improve economically. Their lives, their situation will change. It's the same for all families, especially for women who are vulnerable or very poor, because we know that if girls leave school or have never attended school, it is because of poverty.
From Kifa, we go to Nouakchott, the capital of Mauritania, to meet Sedi Camara. It's a 6-hour drive. 6 hours during which we contemplate sand dunes, camels, and now and then some greenery. We also managed to see the Mauritania, a rocky mountain range which extends on more than 2,500 kilometers from Morocco, passing through Mauritania all the way to Senegal. At the end of the 600 kilometers, we meet Sedi Camara, the focal point for fistulas in Kifa for the Ministry of Health of Mauritania. She is also the president of the NGO, the Association of Voluntary Women for Development, which works for the promotion of maternal and infant health. Between 2010 and 2019, about 300 victims of fistulas were identified thanks to the work of Sidi and her NGO. On the 300 victims, 150 were cared for in Kifa and elsewhere in Mauritania.
Je consacre la plupart de mon temps, mais la plus grande partie de mon temps à communiquer avec les infirmiers.
I spend most of my time communicating with nurses and midwives and persons who are close to the populations, women who are in charge of cooperatives who are active in the towns and that I use as relays who are part of the community setup that is used to help identify these women.
Qui font partie du dispositif communautaire qui a été mis en place pour un peu aider à l'identification de ces femmes.
I spend most of my time doing that. If there is a case of fistula, I will look after that. I will meet the woman, and when I am informed that there is a case of fistula somewhere, I get in touch with them through phone if there is a network coverage. If there is a problem and the lady has no means to come, then she will be cared for through the community. I will go through the nurses and my colleagues, the midwives and the health personnel.
Are cases of fistulas frequent in this locality?
Cases of fistula were very frequent. At the beginning, when we started to talk about fistulas, those who were here already started to come out. With the sensitizing and the training of the health personnel and the vulgarization of the notion of fistula, women started to come out, so we were able to identify the cases. But now, in the healthcare centers, as there has been an improvement of the quality of services, the cases have started to decrease. But in remote areas, where there is no quality service and where there is a lack of access to health services, it continues to happen.
Bien, à Kifa, nous avons rencontré Kumba.
In Kifa, we met Kumba, who never ceases to thank you because it's thanks to you that she knew that she was a victim of fistula, and it is somehow thanks to you that she got treated from the fistula. So how did that all happen?
It was during a mission, a regular mission that I do in Ibrata, which is in our region, to see what is done in health centers, and also to sensitize on fistulas. So I was there, I met a group of women who were sitting in the midwife's office. Some were there for antenatal consultation, others for family planning, and many women were there with carers. So I asked the midwives if I could lead an educational session with them, so I did so. I led the session and spoke about fistulas, and Kumba was there amongst the women. I think she had come to support another woman. So when she heard about fistulas, it caught her attention.
So I can imagine it's not an easy job to find these women in remote areas. How do you do it, financially speaking?
We have created an association called the Association of Voluntary Women for Development, which was present already, but that worked in another context, in development in general. So we introduced the issue of fistulas to be able to help these women. And that is how we created this association. And since then, we have done sensitizing work, and we do it whenever we have the opportunity. We mainstream it in our everyday activity.
Et vraiment faire de la sensibilisation, vraiment mettre ça dans notre quotidien et pour pouvoir recruter les femmes.
And I have received the support of the UNFPA for the project of identifying women with such difficulties, and another project for the care and the social reinsertion of women. And the UNFPA has financed the project. So each time that we elaborate a project, we submit it to the UNFPA.
On élabore un projet, on le soumet à l'UNFPA.
Despite these efforts, the challenges related to fistulas are numerous in Mauritania and in Central and Western Africa in general. This area, indeed, is the most affected, with more than 1 million cases, of which more than 50% are in Nigeria.
Au niveau de la prévention, nous pensons qu'il y a un gros travail à faire.
In terms of prevention, we think that a lot can be done, and for that we work with the West African Health Organization, who has the mandate in West Africa to integrate prevention and fistulas in the training curriculum for midwives. I think that is something that will be done rather quickly, maybe next year, and we are working on it. Secondly, we must note that fistulas is an illness that women hide. They hide it because it is an illness that is seen as shameful, so we need to find the women where they hide. That is why the active search of women through the community and voluntary base is important, because they will not come spontaneously and say, I have fistulas. In fact, many even don't know what it is. In some countries, they say it's a curse or witchcraft. In many countries, many things are said about fistulas, and there are many taboos, which mean that we need to have staff that are aware and that can go into the community and do what we call a verbal diagnostic by asking a few questions to women. This will help suspect cases of fistulas that can then be confirmed by a doctor.
As regards to women's access to reproductive health services, Mauritania has made important progress these last years.
Since 1994, the Mauritanian government has considered that the implementation of the ICPD action plan is a vocation. We can mention two figures. Since 1994, the Mauritanian government has considered that the implementation of the ICPD action plan is a vocation. We can mention two figures. The level of assisted childbirth that has gone from 40% to 69%, and the contraceptive prevalence level, which was at 4% and is now close to 18%. This shows the fact that the government has taken charge of things with the support of the partners, including the UNFPA. We were the first to support the training of gynecologists in the country to reduce maternal mortality. The levels have reduced considerably, even if they are still very high, and that a lot needs to be done. The religious leaders are talking more and more about abandoning female genital mutilation, which has always been a taboo. Now a fatwa has been decreed by the religious leaders. This shows the importance of the implementation of the action plan by the government and also the organization of the civil society with whom we work for the implementation of this plan.
In the health center in Sebka, one of the deprived neighborhoods of Nouakchott, antenatal consultations and the adoption of contraceptive methods have increased steadily over the last years. At the same time, maternal and infant death rates have significantly dropped, as reflected in the observations of a midwife. Her name is Rokhaya Diawara, and she has worked here for 10 years.
En 2017, par exemple, on était à 11 décès maternels.
In 2017, we are at 11 maternal deaths, and in 2018 we had 3 deaths, and now in 2019 we have had 3 deaths so far at this end of September. And also it's important to say that with these figures we also have the fact that we have family planning and the spacing of birth that has had an impact on these figures, which we can see that are now decreasing. Because women are increasingly adhering to the long-term methods. There are implants and the IUD, to which the women adhere. They adhere to it thanks to the sensitizing work that has been done upstream. A lot of sensitizing has been done with the Association of Midwives, the ministry as well. Everywhere in the country, there has been sensitizing activities. The religious leaders have also been involved.
L'implication des leaders religieux.
In Arafat, another district of Nouakchott, we meet with one of the most famous religious leaders in Mauritania for being committed to the improvement of women's conditions, their empowerment and their right to health. Since 2009, year of his PhD, Sheikh Ould Zain has been relentlessly researching Islam and the condition of women. He has produced several writings in which women occupy a key place. In 2010, Sheikh Ould Zain was one of the first Mauritanian religious leaders to launch a fatwa, a legal notice in Islam on female genital mutilations.
We have started a jihad. It takes time for people's habits and beliefs to change. It's not a police decree that we can apply over a day. But I think that now it's no longer a taboo. Many people, many men, many women accept it no longer in Mauritania. They no longer practice it. We don't have exact results, but we think that some 100 imams have been sensitized in many localities. And I think that if we do more sensitizing, it will have a great value for Islam and for Mauritania.
Alongside religious leaders, networks of young people such as Afriyan also do remarkable work to capture the demographic dividend in Mauritania. In this country, where the youth represent more than half of the 4,005,000 inhabitants, the objective of Afriyan is to make them true actors of development. This youth movement recently held a sensitizing meeting in Dar el Baida, one of the neighborhoods of Nouakchott, where the demographic boom has reached worrying proportions.
Our first activity was to launch our consultation in this neighborhood where we find ourselves presently, to the benefit of the impoverished population who are really abandoned. So we thought it necessary to sensitize and discuss with young girls on the topic of family planning, where the indicators were at 250 and where we have reached 259, so we exceed the target number. And there were a lot of women who came to answer the call. These consultation days really focus on women's issues, girls' issues, gender issues, and related to family planning, how young women can get involved in family planning and space birth.
Chaque jour, il vient ici à l'hôpital pour demander de faire la planification familiale.
Every day they come here at the hospital to ask for family planning, so they have understood the importance of family planning, and there have been about 400 women who have gone to see the gynecologist. Many women who are pregnant don't go to the hospital beforehand. They only go there the day of the birth for the delivery. But now, when they see the importance of going to the hospital to take precautions before the delivery, they do so. People are sensitized, and they found that this day was really important for these people. Because Dar el Baida is really vulnerable. There are many people, and you see here many women who have 7, 8 children who are very close in age. But now they have understood the importance of family planning. In Mauritania and elsewhere in Central and Western Africa, several indicators show that many efforts remain to be made in order for the continent to meet the 3 transformative results, which are 0 unmet need for family planning, 0 avoidable maternal death, and 0 gender-based violence, and an end to harmful practices such as child marriage and female genital mutilations. Pledges made at the ICPD, the International Conference on Population and Development, held in 1994 in Cairo, Egypt.